This is the Dr. Don Show. It's your health, it's your life on the Astral Radio Network. Now, back to the show.
We're speaking tonight with registered massage therapist. She's a member of the Massage Therapy Association of British Columbia, Anne Hong, and we're talking about the benefits of massage therapy on your pain and recovery. And let me read you something from the Ministry of Health. This is one of my favorite phrases here. The greatest untapped resource in healthcare is the consumer. Well-informed patients get better care from their doctors and provide better care for themselves. The issue at hand is how to get the right information into the hands of the right person at the right time. So this is all about what you're doing with children overseas. You're trying to give them information as you go along to the caregivers there. And this is something that we see constantly and locally as well. Let me ask you a simple question here. This is something that most of our listeners can all relate to. High heels, women's high heels. And I'm looking around the studio here, and I'm seeing a few high heels here in the studio tonight. Art, it's not you. But in any event, the issue of high heels goes around every now and then. And high heels, 1, 2, 3, 4, and higher inches, it literally changes the mechanical weight bearing of the ankle, the knee, the hip sockets, the back, the old bones connect to the tailbone type song. So as a massage therapist, what's your professional advice to women today, to young girls today that are looking at shoe styles? I mean, one of my daughters was wearing flip-flops in the winter. I don't think she even owns another pair of shoes. No, I'm just kidding. I'm sure she does. But what about the effects on women developing years as well as adults on the effects of heels on the spine and muscles?
Well, I think as long as we educate the women of today that they have to offset that by doing strengthening exercises or stretching exercises to compensate for when they are wearing the heels, then, I'm all for fashion. I'm 100%. So I'm not going to stop wearing them.
So it's like many other things in life. We do things even though that we know they're not good for them. But as far as that goes, your advice to women is to be aware of the effects of high heels on their structure and exercise?
It's how it changes your center of gravity, so that your muscles, there's certain muscles, it's changing how you are aligned in gravity. So
Right.
You have to figure out, okay, which muscles are being pulled and being made tighter because I'm wearing these heels. So when you aren't wearing the heels or you're doing your exercise, you got to stretch out things like your calves. You have to strengthen your core so it can compensate for that hyperextension in your lower back.
Right.
So things like that. So I think it's not a problem if you have a strong core and you're doing proper strengthening exercises. But if you're just wearing heels all the time and then not worried about how it's affecting your body, then it's going to be a problem in the future for sure.
Now, as you heard, we have a sort of a favorite exercise that we recommend to listeners and patients and everyone alike. Pretty much everyone who's got a spine. That's all of us. And we recommend this because it functionally starts movement in the spine. And if there's functional movement of the spine, it goes a long way for prevention as well as helps the effectiveness of treatment. Do you have a favorite exercise that you give to your patients, or a favorite exercise recommendation that you regularly give to your patients?
Probably a pec stretch for the chest.
Stretch?
For the chest,
Okay.
Because we are always doing things in front of our bodies, so we're constantly having hypertoned chest muscles.
Okay, so for our
Yeah.
listeners who are not registered massage therapists, that's the upper arm. The chest, the arm.
It's the pecs, the big
Lift
pecs.
the arms.
Sorry?
Lift the arms.
In the doorway,
Okay.
the doorway stretch.
Go to the doorway.
Go to the doorway.
Yeah.
Support your forearm against the doorway.
Yeah.
And you're standing with your feet shoulder width apart, and you're going to step forward with your same side foot.
Yep.
And then just bend your front knee.
Yep.
So that you feel a nice stretch through the front of your chest. That's going to open up the chest and take a load off the posterior or the muscles in the back.
So you do this by raising your arms about
About
halfway,
90 degrees.
90 degrees. So
Or
your arms are like
a little bit
straight
high.
out. Then you bend your elbow, and then you lean against your elbow and your arm.
Yes, essentially. If you want a better picture of that, I can definitely email them if they email
I'm
me.
sure you got a better picture than what I just described.
Yeah,
But for listeners,
I'm
this is about
usually
moving your
demonstrating
arms.
this. It's about opening up the front of your body
But you do it
because,
by moving your arms. So,
oh
because
yes.
if we don't tell the listener you got to move your arms, they won't know what we're talking about.
You know what? If
Okay.
you Google pec stretch, there's lots of great images on Google
Ah,
that
see,
show it.
Michelle found it.
Yeah. So
Okay.
if anyone out there is interested in this stretch, you just Google pec stretch, and it's got some great examples online. And it looks like something you could do in your home, at your office, on a break. So that's great that you don't need any special equipment or anything.
And the good
like
news is Google doesn't care how you spell the word pec. They'll find it for you anyway.
Hmm.
Now, this isn't going to work with frozen shoulder, bursitis, and those other chronic things that we know about, is it?
Well,
Or it could help,
it could help. It depends on the stage,
right?
right?
Because some of the cares and recommendations I've seen for the chronic bursitis and frozen shoulder, it's all about walking that hand up the arm, walking the hand up the wall, as they call it.
Yeah.
Okay, so you like the pec stretch to
Yes.
help people improve their upper body muscle tone and function?
Not to improve muscle tone, but just to take the load off the posterior because basically we're always doing things in front of our
Forward.
body. So the back is always getting stretched out. So you feel a lot of pain in the back, but really if you stretch out the front of your body, then it creates better muscle balance so that they're not working so hard to keep your shoulders back.
When patients come to see you, is there one part of our body that seems to be expressing more pain and more functional problem than other parts when you see patients? Like, is there one part of the anatomy, is there one part of the body area that seems to require more care, more assessment, more diagnosis than other parts? Like, is it my right knee? Is it my upper shoulders? Is it my back? Like, is there one area that's weaker in us than others?
Well, I wouldn't necessarily weaker, but I would just definitely say the neck because of how many joints there are, mobility wise, having to like hold the head up all the time, and that's generally an area where everybody has a lot of problems with.
What about sleep postures? Do you have any recommendations to your patients that complain to you that they wake up in the middle of the night, they can't sleep well? I mean, the care you're providing them is helping them improve, but they report some sleep issues. What do you recommend for sleep issues?
For sleep issues, I definitely recommend proper pillow support. A lot of people don't have a pillow that's either too high or too low. Definitely side sleeping is probably the best position or on your back, but I don't recommend tummy sleeping.
Nope, because when you lay on your tummy, you've got to turn your
Your
head
head
to the
to-
right or the left,
exactly.
otherwise you're going to smother yourself.
Exactly.
And when you turn your head to the right or left, what happens?
You're just having one side stretched out, one side tight. So
And
it doesn't work.
here's what I like to tell people to do. You know, they say, well, you know, I can sit there, I can do this and that and the other thing. I say, well, listen, tell you what, take a chair, go in the kitchen, sit in the chair in the kitchen. Now just turn your head to the left and hold it that way for half an hour.
No.
You know, rapidly people get the idea that, you know, there's just some things you don't do. So your message is don't sleep on your stomach. Sure, you may turn over during the middle of the night, but try not to go to sleep on your stomach.
Absolutely not.
All right, we've been speaking with Ann Hong, registered massage therapist and member of the Massage Therapy Association of British Columbia. Ann is going to change the lives of children around the world. She's going with the Little Kids Foundation, is that correct?
Yes.
And you're going to Vietnam in December?
I leave November 30th.
That's close enough. And how long are you going to be gone for?
About 2.5 weeks.
And probably when you get back, we'll be going through the usual Christmas and New Year stuff, so we'll look to booking you back here in January.
Great.
And then we'll hear all about the experience about helping children around the world. I mean, what better story than that to show humanity how they should struggle, or not struggle, but should not struggle to get along, because that's what you're going to do.
Sounds good.
And so thank you so much for coming on the program tonight. We'll put the email address out there for people to contact you if
Great.
they have questions about supporting the Little Kids Foundation and helping children around the world. They're going to be able to find that as well.
Okay, thank you very much.
Have a great journey. We look forward to hearing about how well it went. So, Michelle, we've got a couple of more things to do. We're going to be doing Empowered Health coming up again. We've got some new guests on the Empowered Health series.
Yeah, so season 2 is going to be starting very, very soon, and we're very pleased that season 2 is going to focus on education and also research.
We've got researchers from universities in Alberta, Saskatchewan, Manitoba, Ontario, and Nova Scotia. These researchers are going to provide cutting-edge information that is going on in their departments and universities across Canada, and they're going to be each showcased in the 26 segments of Empowered Health.
That's right. And the big key thing here is that how does this research apply to you? How is this research making your clinical experience with your family chiropractor and your treatment that much better?
And I'm glad you mentioned it that way, because last week we were talking, a few of us were trying to plan a research conference for hopefully March, April. We don't have a date yet or a location, but what we are trying to do is do exactly what you just mentioned. We're trying to take knowledge that is being developed in research. We're trying to take knowledge transfer of this research and how it impacts when the doctor touches the patient. All the research is great, but if we don't have a way that actively rolls it out to the health providers, then a lot of it just sits there on words on paper or in the internet and never gets applied. So we'll bring more information to listeners as well as health professionals as to the conference, hopefully in March, April, that deals with knowledge transfer of research, applying it day to day to your patients. And we're also going to be talking with next week, and this is the one that I want listeners to be sure to talk to your family chiropractor. Be sure to come back here next week, Monday, November the 5th at 6 o'clock. We're going to be following up on a program we did last week with Dr. Michael Freeman from the University of Oregon. And our guest for Monday, November the 5th, is going to be a neurologist, Dr. Richard Brownlee. And Dr. Brownlee is involved in the MRI clinic in Kamloops, which is, I believe, the only one that has a weight-bearing or upright MRI. And why is this important? Well, I'm going to be reminding listeners of this as we promo the show for next Monday. In last week's show, the research study did an MRI of 1,200 people. Not only did the 600 that were MRI'd after injury show acquired brain injury from the effects of the brain being pushed into the foramen magnum of the skull, so we were actually able to show brain injury other than just banging your head against the doorpost. But the other really, really valuable thing was the people were split into MRIs done the traditional way, meaning lay down, I'm going to do an MRI, and 300 were done sitting. And the problem is the equipment isn't normally built so you can sit, you got to lay down. However, the equipment is now being built or has been built for a while so that the seated MRI is done. And the findings of acquired brain injury of this area rose almost 300%.
Which
so
is huge.
Dr. Brownlee in Kamloops has the MRI that will do weight-bearing or upright MRI, and this is going to be a real critical evaluation for people with spine problems and head injuries after some kind of crash. So be sure to tell everybody to listen in next Monday here on AM 650 and on the internet as well. Don't forget that. So on the next show, neurologist Dr. Richard Brownlee is going to join us, plus Alice Aiken will join us over the phone to talk about her new research with veterans and military personnel. I'm Dr. Don. Thank you, Art Factora, for being with us tonight. And of course, Michelle and you, our listeners. Without you, there's no show. So encouraging you to make informed health choices. Remember, it is your health. It is your life. Good night, Gary.